Okay, for the first one, I'm gonna have my patient here, have them keep their lips together. I want their tongue, the front third of their tongue, be on the top of the roof. Here you're gonna be making it's gonna be like if you're gonna make a clunk sound, like, but instead of the clunk, I just want you to hold that position. Once the tongue is touching the roof of the mouth, have the teeth slightly apart, and I'll have you breathe in through your nose and breathe out. So for the next one, we're gonna make sure that our patient here is keeping their shoulders back and retracted down. And here, we can show you how it looks from the back. So you're gonna bring the shoulders back and depress them down. Here, you're gonna do this position 6 times. Again, once you come down and depressing your shoulder, you're relaxed. So this is gonna be exercise 2 of shoulder posture correction. Now moving into the third exercise, we're gonna do a stabilization of the head while it's going into flexion. So we're gonna have the patient interlock their fingers in between and put them behind their head and neck, kind of on the top third of the neck, right underneath the skull. Once the position is here, I want my patient to make a nodding motion, flexing their head. Here, I wanna make sure that their hands position high up on the neck, and that they're not flexing their neck completely forward. It's all gonna be a small movement neck. Interlocking their fingers, top part of the neck. Once in this position, it's gonna be a forward head nod. And we can go over here, and then we can see the forehead nod motion. There we go. Are you seeing the nod motion? Here, the patient's gonna retract their head back and feel like if there's a string going through the middle of the head and it's pulling you up. So we're not gonna be doing a neck extension per se, we're just bringing the head back. And we'll get a side view of this. And we'll do. And then we'll go back around. So now for the 5th exercise, we're gonna do controlled TMJ rotation. For this, I'm gonna have the patient have their index finger feel around the joint where they find their TMJ. And when they find their TMJ, I want them to actively open up the mouth up to the point where they feel part of the joint move it into their index finger. So to start off, we'll find the positioning of the TMJ and open up until you feel the bone pushing into your index finger. And then we can go side. We're moving into the 6th exercise, wrapping up the Rocabado 6x6. To begin this motion, we're gonna have the patient start off with pretty much the first exercise you began with. The first third of the tongue is going to be placed on the roof of the mouth. Again, it feels like you're going to do a clunk noise. Once he has that position established, make sure that his teeth are slightly apart. As he's in this position, we'll have your index fingers and your middle finger, just like such, and put them on the front outer part of your chin. Now in this position, while maintaining the mouth closed, the tongue on the roof, we're gonna make sure the patient goes ever so slightly into resistance, going to the right and going to the left. So it's gonna look something like this. And he's gonna push in to his fingers with movement of the jaw. And back and forth. Go into the right and go into the left would be considered 1 repetition. Again, if we're going by 6x6 of Rocabado, we're gonna do that 6 times. And then when he gets 6 in there, we're gonna make sure that the patient puts their thumbs, both thumbs, right underneath the tip of their chin, same resting position of the tongue. And now we're gonna slightly open up, adding some resistance into the thumb. And it's gonna look something like this. And we'll get a side view. And perfect. So that completes the Rocabado 6x6 exercises for any TMJ dysfunction. Again, refer to your physical therapist if you're having any issues with regard to your condition, and I hope that you feel better moving forward. Thank you.